So this actually is a not easy subset to define. If somebody is having LV dysfunction and has improved and was having a chronic substrate for LV dysfunction and now has improved with treatment, should continue treatment lifelong. But the de novo heart failure or the viral myocarditis, which recovers after 3 months, there I'm not sure, and we do not have actually data, and nobody will be able to answer that question. There, one has to clinically assess the patient with reduced dosage, and one has to follow. But patients who are having a chronic heart failure condition had acute decompensation, and now on treatment they have stabilized and their EF has improved. Those patients should receive the guideline directed medical therapy lifelong. So the ARNI is a molecule of century and it is indispensable. It is superior to ACE inhibitors in reducing CV death, heart failure hospitalization, and sudden cardiac death in patients with heart failure with reduced ejection fraction who were having NYHA class 2 and above or in NYHA class 1 but are having a history of heart failure. ARNI also improves the LVEF and heart failure with reduced ejection fraction and reverses the adverse LV remodeling and improves quality of life in both heart failure with reduced ejection fraction and preserved ejection fraction. ARNI should be initiated as early as possible in patients with acute heart failure and in de novo heart failure, acute decompensated heart failure and de novo heart failure. Here, time is life years. Patient should be stabilized, should not be on IV inotropes or IV diuretics, and after stabilization, we should start ARNI as early as possible. ARNI should be given for at least 3 to 6 months along with other foundational therapies of heart failure, and EF should be reassessed with echo and or MRI before the patient is considered for ICD or CRT. ARNI should be used in all patients with heart failure with preserved ejection fraction up to LVEF of 57%, along with SGLT2 inhibitors to reduce heart failure, hospitalization, and improve quality of life. Thank you.